Am I on? Hi everyone, thank you so much for joining us. I would like to give a presentation on my perspective of mental health and addiction from the long process of healing from adversity to resilience. Oh, thank you. All right. First thing to forget.
No, you're fine. No, it's okay. It's okay. No, what you said is okay.
Okay. So I'm gonna take my slides out. Okay. There we go. So let me introduce myself. My name is Carmela, and I'm a psychiatrist in private practice. I specialize in both children and adults, and sometimes I tell people I'm really a child psychiatrist, and when I grow up, I'm going to be an adult psychiatrist. But I've also received Tokudo in 2014 as a Jodo Shinshu priest, and that alone is my mental illness, or one of them. And of course, studying Buddhism has also become one of my main addictions. So I really like this topic because in one sense it talks about me, but really from a psychiatric perspective, I'm diagnosing all of you as having addictions and mental illness, because that's what psychiatrists do, right? So this slide, Niga Byakudo, or the two rivers between the white path in the middle, basically in my mind, depicts the predicament of the human condition. When you look at this lone traveler in this white outfit trying to cross two rivers with fire and the other one of water. This is essentially the besieged human being trying to flee from affliction to the pure land of bliss, where there is no suffering, there is no worrying about addiction or anything else. And when you look at the bottom part of the picture, you will see beasts and bandits coming after this person. This picture really reminds me of what addiction can feel like from an emotional and cognitive level. It's total freak out with no recourse, no escape. Addiction has this grip on each one of us, and I would say us because ultimately I would like to convince you with this talk that we are all afflicted by some addiction of this, that, or the other. We may not just be aware of what they are until, we look at our ordinary lives and then they just kind of show up saying, oh yeah, I'm addicted to my phone, or I'm addicted to my anger, or I'm addicted to my opinions, I'm addicted to my, being in the center stage, or yeah, we are all attached to something, right? This is attachment in the real Buddhist sense. And so the purpose of this talk is to show how learning the Dharma might be of assistance in not only understanding our afflictions as human beings in general, but how we might be able to apply some of these principles into the specific afflictions that human beings go through, like addiction. And then, oops, how do I change the slide thing? I'm sorry, I'm one of those boomers, so I'm not,
It moved.
It did? Oh, it did move. Oh, well, fancy that. Thank you, awesome. I don't know which buttons to push. I mean, I know which buttons to push with my daughters, but machines, can't negotiate with them. So anyway, London Sensei talked about addiction as a form of dukkha, which in my mind really, dukkha in itself is a shared human experience. Nobody is exempt from it, and it's not even human. I think dogs experience dukkha, cats and plants and anything that has maybe life, maybe even non-living things experience dukkha, because that's what transformation does to everything. It changes everything, and of course, when things change, it's not the same as it was, and maybe it's worse. And then we don't know until we get there. But how do we understand dukkha? So in my mind, I really love this diagram, the Wheel of Life, or Baba Chakra, which is like, well, I'll show it in the next slide, but it's a depiction of impermanence, interdependence, and how karmic forces shape our lives and where it takes us depending on the path that we wake up to, i.e., if we can wake up to the Buddhist path, maybe it'll make a difference. The therapeutic approach I like using in my work really comes from the basic principles of Jodo Shinshu, which is deep listening. I find that just listening to people's narratives brings out a lot of their own thoughts and ideas and understanding about their predicament, because the deep listening part, for me, is very helpful in formulating what their essential dilemma is, but it has to come from their words and not mine. And so it's listening to the stories that they bring that hopefully can shed some light into how they got into this pickle, and also harnessing the principles of fellow travelers on Dobo and Dopio. We are here. We are in this together. Take me through your journey. I'm kind of like your Sherpa. Let me hold your hand while we go deep diving into the mud of whatever it is that you're drowning in. But also it requires, I think, at least from a therapist's perspective, sort of a ruthlessness, and relentless search for the truth. What is really underneath all of this that has gotten you to this point? Let's investigate. But while doing this investigation, it has to come from this openness of mind, this non-judging. I mean, I'll reserve my judgment later when we finish the psychiatric interview. I will give you my judgment. You can be sure about it. That's what you're paying me the big bucks for. But I will hold that for now with this idea of non-harming, and to just allow, the spontaneity of the narrative to come out on its own, and for not just for me to hear the patient, but for the patient to hear themselves as well. Because I think part of the fear here of uncovering the nature of addiction is this fear of not looking into the self, because there might be some real monsters living in there that we don't want to confront. But ultimately, my objective here is how addiction is so demonized in the West that really it is also just another form of dehumanization, and hopefully with this perspective will destigmatize the plight of people with addiction. And of course, in the Western perspective, addiction is considered a reward deficit disorder, which means they just cannot get enough reward in order for this behavior to stop. But on top of that, stress sensitization, it means that the more they do it, the more mired they get into the stressful cycles of addiction itself, which they cannot get out of. It's really a prison. And then on top of that, it dysregulates the brain, and so they lose most of their abilities to make decisions, because the brain fog and the emotional upheaval interferes with judgment, and so executive function is compromised. Things like planning, organizing, execution, completion of things that make their lives better, not things that make their lives worse. And so their judgment is significantly hampered by emotional and cognitive dysregulation. The pathophysiology, the origin of this disorder, can be attributed to a number of factors, really too complicated to spell out, but generally there's the genetic component, there's the childhood adversity, and lifetime adversity on top of that, because when you grow out of your childhood, you continue to live, and then you continue to encounter adversity. There's transgenerational trauma. And according to one study, the trauma genes, once they're turned on, can continue into maybe to 14 generations, meaning that trauma, adversity changes our expressions of who we are down to the genetic level, which also means that any intervention, any treatment can also affect our genetic expressions, depending on what is made available to us. And then you have psychosocial and socioeconomic factors, which makes everything really complicated. And so really from that perspective, it's difficult to know what treatments might work for different people because every human being experiences their own adversity in a very personal way. It's kind of like pain, you know, nobody can tell you how much their pain is until they express it subjectively from their personal perspective. And so addiction is like that, attachment is like that, stress is like that, anxiety is like that. It's all ultimately a very personal and subjective experience. And what we know from treatment programs, you know, you do a diagnostic assessment and then you instill behavior modification approaches, you know, you do detoxification, you do cognitive restructuring, and you do systems work with families and community relationship repair, the self-accountability that Sensei talked about, you know, with the 12-step program, and then maybe a resumption of some functional level of close to baseline that can make them, again, productive members of society. So functional rehabilitation with some sobriety, and of course, prevention of relapse, things like that. So what is addiction? I'm addressing Koichi and your specific question because I think it's really important to know what addiction is. Addiction is compulsive, meaning it is done with this short circuit from an impulse to an action. It is chronic, meaning it's lifelong. It's almost like a personality shaping in the course of time that becomes incorporated to our psyche, to our sense of selves. It's habitual, meaning it's repetitive. It could be a substance, okay, like cocaine or fentanyl. It could be a behavior that we are addicted to, this habits that we do, or it could be a specific activity like playing on the phone. There are harmful consequences, which is really what makes an addiction, is the harm, okay? The harm to the physical, the psychological, the social, even career, certainly financial, economic, all levels of functioning in the human being. So anything that is harmful to that may be considered an addiction. It's an addiction because it is continued regardless of the harm that it causes. It has well-defined symptoms, although when you look at DSM-5, it's all there too. Everybody experiences the same thing. Anxiety, depression, anger, irrational behavior, mood swings, temper tantrums, destructiveness, violence. I mean, we are all equipped with that kind of stuff as well. Now, there are certain characteristics of addiction, which I think is important to understand. Withdrawal is one of them. So withdrawal is what we experience when we do not have access to that which we are addicted to. And you could tell because you kind of have this craving for it that you just, you know, you've just got to seek it and have this gratification. It's almost like you're not okay. You are out of sorts when you're going through withdrawal. And in some substances, you might be physically ill, okay? Seizures, vomiting, agitation, psychosis, and maybe even death, okay? Abstinence, okay? Abstinence is the withholding of the use of whatever it is. Now, abstinence is easier said than done because withdrawal oftentimes interferes with abstinence. And if people can tolerate abstinence for a little bit, then they can basically get through the period of withdrawal. However, we do have mechanisms in place to ease the symptoms of withdrawal so that they can eventually get to the stage of abstinence. And that's kind of what we have in our treatment processes right now that's available. Dependence means that we have this belief that we cannot do without it. And people think that, for example, sleeping medications, they become dependent on sleeping medications, and so they are averse to taking it for a long period of time, and I can see the rationale for that. But really what they're actually dependent on is good sleep. So we have to qualify the dependence is really what we experience when we rely on something, because if it is not there, we'd be screwed. And then we have tolerance. Tolerance means the more that we keep doing something, the more it loses its potency. You know, it's like diminishing returns or something. Like shopping addiction is kind of like that. The more that we do it, the less the effect, and so we have to do it more in order to get the same results, the same gratification. And then habituation is kind of more like a neurophysiological response where over time, it's similar to tolerance, where the benefits basically reduce over time, and the rewards basically are reduced over time. So addiction is complicated. It's not just a matter of letting go and be dragged. It's much more complicated than that, meaning that people would rather be dragged by their addiction than letting it go. That's how powerful it can be. So this is the model that I'd like to go into to just illustrate, at least clarify in my own mind how we get in a pickle, how we get into trouble. And so let me explain the features of this diagram. It's called the Wheel of Samsara or Chakra, which basically shows how our existence, really existence in general, are cyclical in nature. And at the very center of it are three animals. It's kind of hard to see here, but it's a snake, it's a bird, and it's a pig. Okay? Which drives the whole wheel. So the three animals in the middle represent greed, anger, and ignorance. And it's a kind of ignorance that is pretty bad, because it's ignorance of its own ignorance, if we want to put it plainly. And then the three animals then drive karmic behavior or karmic deeds. And so the beings on that circle around the three animals are divided into the light side and the dark side. So the beings on the light side are basically enjoying the results of good karmic behaviors or wholesome karma. And then the beings on the dark side are suffering through the effects of negative or unpleasant karma. And then you have the 6 realms of existence, which are basically the states of the mind, if we were to interpret it psychologically and cosmologically, the states of mind that all beings go through, depending on the karmic conditions that they are subjected to. And the lower 3 are essentially what we call the hell realms, and then the top 3 are the heavenly realms, or the transcendent realms. The most bottom realm here, 6 o'clock position, is basically all kinds of Buddhist hells. And if you Google Buddhist hells, there's all kinds of torture and affliction that you'll find in there that's like really gory. It's like, how did Buddhists come up with this imagery? It's like, it's pretty scary stuff. And then on the position of 7, 8 o'clock is the realm of hungry ghosts, and these are the chronically dissatisfied beings that cannot be satiated, which is what we attribute to the world of addiction, this insatiability. I would kind of slightly disagree with that, because I think addicts and really all human beings kind of go through all 6 of these realms depending on the causes and conditions in their lives. And then when you look at the 4 o'clock position, you will see animals. So this is the realm of animals. And animal realms basically is all about survival. You know, it's all about killing each other and devouring each other, and just to be the last one standing, if you will. And then you look at the top left, well, no, the one in the 10 o'clock position is basically your angry, no wait, is that your angry demons? Okay, no, okay, so this particular wheel is a little bit different. They're all a little bit different depending on which artist you're looking at, but 2 o'clock position are your angry gods. And this is the realm of beings who are so powerful and but really angry that they use their power on each other. Okay. And then on the top realm will be your heavenly beings, and these are beings who are so caught up in their own euphoria, that they're just kind of clueless and disconnected with the rest of the world. And then at 10 o'clock would be the human realm, which is essentially the path to enlightenment. So the main message of this diagram for me is to ultimately become an authentic human being, because then that becomes the way out of the wheel of samsara. And then the outermost circle would be your 12 nidanas, or links of causation, that takes us from ignorance all the way to death. And it's very complicated. I'm not going to belabor all that stuff, but he basically just kind of explains to us the basic principles of dependent arising or dependent origination. So that's what I was talking about earlier. And then you have the Yama. Yama is the demon of death, and he represents impermanence. He has a third eye, which basically is the wisdom that is acknowledging the nature of impermanence itself. And you'll see that there are 5 skulls on top of on the crown that he's wearing, which represents the 5 skandhas, or the 5 elements that constitutes a being. And the 5 skandhas basically are your rupa, your body, your form, with the 5 sense organs. And then you have emotions that come from that, you have mental formations that come from that, and then you have volition, and then you have consciousness. And when you put all of those together, the aggregates, it makes up a being. And then this wheel is basically grasped in the jaws and the limbs of this god of death, Yama. Oh, sorry. And the 4 limbs apparently represent birth, aging, illness. Oh, what did I say? Skills. It's supposed to be illness. I'm sorry. And death. And the tiger that is part of this picture represents the fear that comes with being caught up in this sort of cyclical existence. These are the 12 nidanas. That's probably for another talk. But anyway, also in this diagram is the Buddha pointing to the moon, which is the path to liberation, i.e. the Eightfold Path. Okay, so Landon Sensei talked about the truth of suffering, and hopefully for most of you are familiar with the Four Noble Truths. There's actually supposed to be 8 sufferings in all. Besides birth, sickness, aging, and death, there's the suffering of loss or separation from loved ones. There's company we don't like. There's desires that are unmet. And then all the suffering that comes from just having a constructed self, or the 5 skandhas or aggregates of a self. So my main concern really is, what is at the heart of all of this? How does one become a miserable addict in some sense or another? And I'm not talking about just substance use disorders, but really part of the dilemma of the human condition is, why do we become so attached to something that we cannot refuse or that we cannot escape? I chose this picture because the psychotherapeutic process for this is like uncovering and uncovering and uncovering layers and layers and layers of ego defenses. I thought, what is this nesting doll thing? When they first come into the office, I see the outermost covering of who they are, because they want to present themselves in a certain way, but really I know there's more there underneath the surface. And really the whole idea here is to make enough of a safe connection with this individual so that they can start to unravel and really come clean with what they hear themselves saying, and find all these untruths that they say about themselves and the untruths that people say about themselves may be learned or maybe something that they have developed in the course of time, and which really disrupts who they are as authentic human beings. So all of these coverings, layers of ego, defenses can distort the authentic human being, which is really what we need to get to ultimately in order to find a way out of it. So it's like going in is the way in, is the way out. And it's exhaustive because it requires a lot of one-on-one, intensive, painful work. People, I think, really hesitate on investigating who they really are because they're scared. And so the therapeutic approach that I seem to find most healing is to just be there, be in the presence of that fear, to be with anguish, to be with the tears, to be with the anger. That comes from years of training, I think, but also I think a good dose of stupidity, not knowing, what's gonna show up. You're just gonna there. It's like, oh, oops, here we are. So we're just gonna sit through this, and oftentimes I find myself sitting with this misery for years, even months and years, where people are just so stuck, cannot get any further because there's something they're protecting that they do not want to get to. And this is what we call often treatment resistance. So we sit with the resistance. The whole idea here really is to never give up, to stay committed to this process. And it's exhausting, especially for certain aspects of clinical practice that really requires this sort of intensive and consistent work. So I want to turn our attention to really the beginnings of life itself, adverse childhood experiences. We have a rating scale called ACEs, which is a 10-item questionnaire. But basically it asks people to just check the boxes of certain types of adverse experiences that they've had as children. And it basically covers essentially 4 aspects of abuse, okay, or adverse experiences. Emotional neglect is one of them. Sexual abuse, physical abuse. The asterisks basically indicate the strongest predictors for substance use disorders outcomes. Then there's also household or family challenges like domestic violence, or a parent has substance abuse issues, or a parent has mental illness, or the parents went through separation, divorce, or incarceration. So the critical wound that we're trying to get to comes way before the development of the addiction itself. Emotional neglect. So this is very subtle in a sense, because when people are not even aware of what emotions to express, of course these emotions will go unnoticed. But when you are in circumstances that it's not safe to express anger or sadness or fearfulness, then those emotions essentially go unnoticed and unrepaired and invalidated. And emotional neglect goes very deep into the heart of a human being, because the ultimate message there is you don't matter. Your feelings don't matter. This sense of unimportance or insignificance is ultimately a very painful experience, complicated experience to go through. And then you get abuse on top of that, where you're intentionally hurt physically. I mean, I don't know how people even survive this kind of abuse, much less get into their adulthood and transform into amazing human beings. Isn't that incredible? This is really where I think the pith is of this whole process, is how this transformation happens to the most broken and wounded people. and emerge on the other side. It's like this amazing bodhisattvas, really. Isn't that cool? That's fascinating. Okay. So when I see adults in my practice, well, I see children too, which are so much fun, I'll tell you. But when I see adults who are so caught up in this cycle of alcoholism, for example, where they have developed cardiovascular disease and cardiac arrhythmias and diabetes and autoimmune, and it's like, holy cow, you're like a superhero. I mean, you've been wounded by your own life, you're still here, and look at what happened to you. So part of the messaging here, I think, is, which doesn't happen often enough, is also to show how they do have resource, they do have strengths that they have fallen back on, notwithstanding that a lot of these behaviors that allow them to get through into their adulthood are also their survival responses to the traumas that they have experienced, but at the same time also have them caught up in dysfunctional patterns of behavior. So they're both. They're both reparative and they're both destructive at the same time. Go figure. That is the dilemma right there, isn't it? That is the paradox. Yeah. Okay, so one of the traumatologists I really like to read and talk about is Besser van der Kolk, The Body Keeps the Score. And in his writing, he talks about how trauma and memories of trauma are stored in our cells, in our physical bodies. So aches and pains, right? Inflammation, fractures. Our bodies hold memories of past trauma because our bodies do not lie. Our minds will lie, but our bodies do not lie. And so in trauma work, for example, the first order is to really become in touch with the body, okay? Awareness of the body, which really makes me think of the Satipatthana Sutra, or the Four Foundations of Mindfulness, which begins with awareness of the body. Isn't that cool? I mean, it's all in there, you know. How to heal the human condition or human affliction. It's all in the sutras. It's totally amazing. So anyway, Van der Kolk is a psychiatrist who's worked with veterans, and he says in his book, our trauma comes from the lies we tell ourselves. I would like to add that our trauma comes from the lies people tell us about ourselves. Because we are constantly judged, right? And the reason that we are constantly judged is because it is also in our nature to not look at ourselves, meaning we turn away from self-awareness and look at ourselves, but it's easier to see other people and their shortcomings than to see ourselves and our shortcomings, because that's shameful, right? We cannot deal with shame and guilt. Sometimes my patients would say, guilt is the main thing that keeps me from transforming, and there's also this cognitive restructuring, I think, that has to happen, and that is that shame is a virtue, or guilt is a virtue. Because if you did not have guilt or shame, you'd be a serial killer. And they go, oh, I never thought of it that way. But this is kind of what Buddhist teaching has taught me, is that paradox, right, is both, and it's neither, and you can really play with it, depending on how you interpret it. Sometimes we play this game in my office where we would switch places, and I would have them sit in my chair, and I would sit in their chair. And then I would ask them, well, what do you see? Well, it's a different view. It's the same room, same thing. This is what we're trying to do with your mind, is to allow your mind to see things from other perspectives. 84,000 paths, basically, right? So there are traumas we invalidate. Invalidate meaning we're saying it did not happen. It's okay. So when a child falls, right, and gets hurt, and we go, oh, you're okay, you're okay. The child starts to cry because it hurts. Instead of saying, oh, that hurts. Oh, where are you hurt? You know, validating the pain. What do we tell the child? Oh, you're okay. Just get up. Right? This is invalidation. It's real. The child was hurt. Do we do that with ourselves when we get hurt? Oh no, we are strong, man. You know, we go out there and play football. You get knocked out of your senses, and you just get back up and you start playing again. It's like, what is this? This is so But yeah, it encompasses a lot of territory. The traumas invalidate experiencing form of oppression. How many of you have experienced oppression? Okay, yeah, I remember when I was a kid, I ran away from home and I stayed with my best friend. Because of, I don't know, some stupid thing. Then my dad finally came to get me, and I said, if there were no dictators, there would be no rebels. And he left me alone. But you know, things like that, right? There's divorce, undiagnosed health. Oh, chronic illness. Chronic illness. That is traumatizing. Because the moment, well, even children, right? Some of them go through the repeated medical procedures, for example. It does something to the brain. It changes the brain. It increases this panic button called amygdala, which is like, you know, the fear factor, right? That's the button that you push, you want to freak somebody out. And then there's right next to it is the storage space that holds our memories. That one shrinks, you know, as a compensatory mechanism. Like, I don't want to remember that stuff, so it shrinks, okay, hippocampus. But yeah, things like that happen in the brain in the course of time. So you can imagine what unaddressed, unhealed, untreated childhood trauma does to an adult by the time they get there. And we have built-in crisis or survival responses, okay? So the most adaptive apparently are fight or flight, because if you can fight, you're a hard kill. I mean, there's a good chance you're gonna kill it first before it kills you, kind of thing, right? But out of that comes, of course, this fuel of anger, hostility, rebellion, vengefulness, vigilantism, that fearlessness factor, right? I mean, when you're fighting, you cannot afford to be gripped by fear, because fear will freeze you. So flight, you want to get out of there. And it's interesting because when I was going through a traumatic event in my life, i.e. divorce, the first thing I did was study martial arts, because I was so, okay. Because I'm not going to run away, I'm going to fight this, right? So studied Aikido and weapons and Tai Chi and Kung Fu and all that. But the first rule, apparently in martial arts, is in order to avoid any injury at all, get out of there, right? That's the first rule. And then fighting comes later. But yeah, fight is basically the avoidance of pain, because we all need the immediate sense of comfort and safety. Freeze is when your internal resources are basically not working, like everything just kind of stops in slow-mo, like deer in the headlights kind of thing. Okay, emotional numbness, associations like that. Fawning is interesting because this is very common in traumatized population, is people-pleasing. We see that now, right? As things play out, right? People capitulate, they acquiesce, they try to appease the aggressor, be on their good side, the yes man kind of people, right? That's fawning. It's also a survival mechanism. And then flop, of course, is just, you're done. Shut down. Nothing can be done. And in this case, I saw this saying, if you're tired, all you need to do is rest. You don't need to stop. Just rest. So flop to me means surrender to the crisis and rest. It's like the Tanaka Sensei's book, right? Ocean. You're swimming in this ocean and there's no land inside, you get really tired. Well, then all you gotta do is let the ocean carry you for a while until you regain your strength. And then you can start swimming again, like that. So sometimes I have people just lie down on the couch. That stereotypical picture of a shrink's office with a couch. Yeah, it's kind of like that, just laid out like that. It's great. Then play a little music, it's really cool. Four Noble Truths, this is all kind of where it comes down to, is understanding the nature of the human condition with the Four Noble Truths, that life is not always going to be peachy keen, it's going to be uncomfortable, then because we got attached, then we become hungry for it, which we define as addiction, but really, it applies to just about everything, right? Like this really good, juicy orange that you brought. Just like, I started to get anxious when it was starting to run out. I was like, oh no, the oranges are starting to run out. What if they run out? I won't have any. I said, it's still silly stuff. Yeah, Blake's oranges. And if suffering exists, then there's also such a thing as non-suffering, right? That. And then the Eightfold Path, okay? Eightfold Path, the middle way, right view, thoughts, speech, conduct, livelihood, effort, mindfulness, meditation. This is the Buddha's prescription. This is the moon that the Buddha is pointing to, basically, is all of this. Okay? But easier said than done, huh? Like we say in Buddhism, we don't have commandments, but look at what we are being asked to at least contemplate on right view. What is right view? If there's right view, is there wrong view too? From a relativistic perspective, of course, there's a right, there's a wrong. But also another way of looking at Buddhist psychology is that there's no right or wrong. It's just that. It's just view. It's just thoughts. It's just speech. A tree is just a tree. But our minds are complicated, right? So we have attributions and interpretations and perceptions to anything which comes from our conditioning, which comes from the karmic forces that shape our lives, which come from transgenerational training. I mean, all of that factoring into how we think. So we need a guidepost, I think, to come back to and reevaluate everything and see if we're still, if any of this is still making sense. For me, that's kind of what Dharma is. Okay, so how do people cope with traumatic events, with adversity? Well, these are exactly the same obstacles that keep them from getting sober, okay? Because of all this violation of trust and safety, of course there's going to be mistrust, there's skepticism, there's suspicions, they're hypervigilant, okay? There's negative attribution, so even if another human being means well, the intention is often missed and misinterpreted as hidden agenda, right? Being manipulated. And so I would like to refer to Hongan now, the three minds of Hongan, the 18th vow, basically as a, maybe a construct on how to maybe neutralize the poison that is inherent in having been traumatized. So how do we build joyful and trusting in the concept, in the presence of mistrust and skepticism? So it's like turning that whole heart mind around, right? Completely 180 degrees. How is that done? Then there's manipulativeness. Of course, people with addictions are very secretive and devious, and they minimize, they rationalize their use, they deny, oh no, I'm not an addict, or I'm not an alcoholic, right? There's withdrawals from society, right, to hide that devious behavior, versus sincerity and authenticity. How do you get people to, quote, come clean? I mean, come clean is a phrase we often use in addiction treatment centers, right? Coming clean. What does that mean? So from a Buddhist perspective, it's really being honest with oneself. But people can be honest with themselves without necessarily being honest with everybody else around them, because there's so much shame and guilt that comes with addictions. And then you have the hopelessness and the helplessness, the loss of self-power, if you will, in the number one step for the 12-step program. There's hopelessness, helplessness, worthlessness, shame, guilt, resignation, I will never get out of this. You can't have a sense that they're continuously stuck. And it's a good reminder to bring up the impermanence principle, right? This too shall pass. It may pass like a kidney stone, but it will pass. And so the antidote for that could be the aspiration to be born in the land of bliss. And that has to be qualified, I think, into something more pragmatic and kind of more in the moment, like the aspiration to get better, to feel better, to do better. I think that that's enough to maybe turn the heart mind just 1 degree over for now, so that eventually it'll be a different trajectory than the path that they're taking now. Okay, so the question becomes, how can one's heart mind be transformed to one of entrusting, of sincerity and honesty and authenticity and aspiration to get out of dukkha? How does Namo Amida Butsu work on our behalf? How akunin do we have to be in order to desire, to want to get better? So these are questions that I often raise because I never know when people are ready to turn their lives around. All I can do is sit there and be in the mud, which is not bad actually. Sitting in the mud. Okay. So from a therapeutic or treatment perspective, the antidote, they would say, would be positive childhood experience. I would say, I put parenthesis childhood because it really has to be positive entire life experiences. Okay, not just childhood. I mean, it's never too late to have a happy childhood in your adulthood if somehow we can bring ourselves to experience positive experiences. Because all of these can cultivate resilience. Okay, resilience, survival, right? Growth, post-traumatic growth, we talk all about that. And this is maybe where Nikon can come in. Okay, and I'll talk to you a little bit about Nikon later. So what is resilience? Okay, and this is Shantideva in the way of the Bodhisattva. Resilience essentially is the mind of the Bodhisattva. Okay. The mind that is pliant, the mind that is playful, right? They are the qualities of the awakened mind that focus on all beings without exception. So non-discrimination, it's egalitarian. I suffer, you suffer, we all suffer. That sort of thing. There's no separation between me and you. And also to help them attain Buddhahood. So if there are not Buddhists, I mean, there's a lot of work to do here. As far as interpreting what is Buddhahood, what I try to do is Buddhahood is to just open the mind to what reality really is. And maybe when we open the mind to reality, it ain't gonna be so pretty. We'd rather take the blue pill, delusion, like in the Matrix, instead of the red pill of reality, because it's too painful to live in the reality itself. So we have to have an escape, an escape pod or an alternative earth. I think that's what all the gaming is all about too. It's an alternative reality that is way more controllable than the one that we have right now. But the thing is that, how can you enjoy an imaginary hamburger versus a real hamburger? So it's gonna cost you too, to live in an alternative reality. So part of this is lending the ego. Okay, as part of the therapeutic process, lending the ego to this person next to you. Let's look at your reality together, because it's freaky to do it on your own. Okay, and this is where really the ruthless investigation is to the roots of one's trauma comes in. Because if we cannot get to the wound, how can we get it to heal? The idea here is to get to the wound itself, which is a very painful process because people think it's going to rake them over the coals again, that they're going to be re-traumatized again if they recover some of these memories. But they also have to be reminded to stay in the body, that you're looking at this child, this injured child at age 7 from your adult self that has already gone through all of that, that's already experienced life, and already has gained so much wisdom and experience that now you can come back to this wounded child and embrace it. Oh, this anger is your child. This sadness is your child. this invisibility is your child, like that. But now you also have this adult who can do that. So sometimes people have to be reminded about what their selves are. You know, internal family systems, what they call it, are all these interjects of different parts of ourselves. And addict is just one of those parts. So when therapists talk about parts therapy, they're really talking about parts of the constructed self, i.e. the 5 aggregates, skandhas. And when the mind is flexible and joyful, it can basically go through the ins and outs of the challenges that life can bring, right? It's kind of like a river, right? Or, we talk about poo sticks. You guys know about poo sticks? Winnie the Pooh and Piglet and Christopher Robin would play this game called poo sticks. And they would go to this little stream on this little bridge, and they would each choose a stick to make sure that, you know, it's their stick, so unique kind of stick for each one of them. Then they would throw their sticks down to this river, and then they would run to the end to see which stick got there first. And so they did this game, and then Pooh basically said, oh, that stick came first. It's my stick. So how did Pooh's stick end up first? It's because his stick did not get caught up in the obstacles along the way in the river. This is kind of like what resilience is to not get caught in these obstacles, but you just kind of go around them. This is also resilience, I think. For in cognitive neuroscience, they call it cognitive flexibility. It's a mind that can zoom in and zoom out. It's a mind that can see from underneath, from above, from the side, from all angles, like the 10 directions kind of mind, okay? Because when people are able to see their predicament from different angles, it forms a more complete picture of what's really going on, as opposed to being stuck on bias. And bias is dangerous, right? Because you've already made up your mind that this is so, and you cannot be wrong. And so this is kind of where I think doubt comes in as far as faith is concerned. The more doubt, the more faith, meaning that the doubt itself allows the mind to be flexible and unfixed. And this unfixedness of mind is what allows possibilities to come in, what allows healing to come in. It brings hope and potential solutions and critical thinking and all of that. So yeah, what we're aiming for is cognitive flexibility, which is to me similar to the mind of a bodhisattva. And this quote, minds are like parachutes, they work best when open. And then Megan Sensei went through all the practices of the bodhisattva, the 6 perfections, right? Compassion, altruism, renunciation. There's 37 practices. I mean, from a Jodo Shinshu perspective, that's a lot of work. I can't do those 37 practices. I can't even do dana, you know. I like to keep some of my things to myself. I'm not giving them away. So, with the mind of a bodhisattva, even from a Buddhist perspective, and Jodo Shinshu particularly, that's just kind of theoretical, you know, like, yeah, people can do that, but I couldn't. Okay, I'm greedy, and you know, I like to keep playing on my phone, and I don't want to take that call right now, kind of thing. But what we know is that Amida Buddha was a bodhisattva, and the only way he became a Buddha was because he fulfilled 48 vows. Okay, I mean, who of us can fulfill one vow? Okay, and not like backtrack on it later. I mean, so, you know, when you talk about what can you trust or who can you trust, certainly not human beings, but you can trust a bodhisattva. So what is this primal vow? It's basically the inclusiveness of salvation, if you will, from the wheel of samsara, okay? But if somehow we can open our minds to the mind of Amida Buddha, i.e. Shinjin, that is sincere, that can joyfully entrust, that desires to be born in the Pure Land, i.e. desires to be delivered from suffering, and say the Nembutsu, call my name, Namo Amida Butsu. Should not be born there, may I not attain perfect enlightenment, which means that if the Buddha has already fulfilled those vows eons and eons and eons ago, then our salvation is a done deal. All we need to do is wake up to that fact. Easier said than done, though, right? So this is where this whole process of awakening, I think, is a critical part of the healing process, is to awaken to the nature of reality. And what that means is to awaken to the real pain that's in there, to awaken to all the injuries and wounding that we go through as we live our life. And this is true for every human being. No one gets through this life without getting chipped, right? That's just kind of part of our reality. But that's not the only thing we look for. We also look for all of the attendant factors and causes and conditions that allowed us to get through those trying times in our lives. Otherwise, why would we be here now? There's got to have to be some way of getting through those difficult times in our lives. And this is where Nikon comes in. So Nikon literally means self-reflection. But Nikon asks the 3 questions that allow us or force us to just look at plain, ordinary reality in 3 lists. Okay? What have I received from others? What have I given others? What troubles and difficulties have I caused? In the first question, what have I received from others? These are the ordinary, concrete manifestations of causes and conditions that bring some relief to our suffering in some little way. Like my phone brings me so much relief when I get bored, especially because boredom is painful, right? But then we are asked the question, what have I given others? So it assesses our own capacity to be compassionate as well, to be kind, because otherwise, if we cannot see our own capacity to be real human beings, then what does that make us? So it's important to see our own humanity, but to see our humanity is also to grapple with the fact about our own vulnerability, that we need others to take care of us at the same time that we are trying to be good and kind and generous. So they come together. We are being taken care of, and we are also giving care. So they're simultaneous. Troubles and difficulties we have caused. This is where I think reckoning with the ego is really very difficult, especially with traumatized population, because they already carry a lot of guilt and shame about their own wrongdoings. And so to put the number 3 question, what troubles and difficulties have I received, needs to be put in the context of a greater picture of what I have received unconditionally and what I have given without thought of getting anything back in this context of how this ego has been hurt at the same time. So it sort of creates this complex picture of suffering is there, but comfort is also there, and self-awareness is also there. And when that vision is clear about our shared experience as human beings, now we can come to hopefully a place of clarity about where we fit, where we can be recognized as real human beings in this big universe, okay, outside of our families of origin, which could be where everything started from. This is where we find our place in the universe. This is where, if you will, the call of Amida has reached us, and that we can respond now to this greater purpose, because there's no other way. There's no other way out of this predicament except to listen deeply to this call, the vow, the promise, right? That ultimately it's gonna be okay. We're all gonna be okay despite of all the bad things that have happened to us. We can be okay. This is the mind of aspiration. And this is kind of maybe, from a therapeutic perspective, the installation of hope that we want to invite our patients at the very first meetings, or encounters, the installation of hope, and then ultimately the establishment of entrusting. And so when they ask, who can I trust, what can I trust? Certainly not me, don't trust me, okay? I don't even trust myself. I don't know what time I'll get up tomorrow morning, what kind of mood I'll be in. But what you can trust is the path that you're in. Only you will know whether you are on this trajectory of getting better or falling more into the realms of hell. That's for you to decide. That's not up to me. So it's almost like relinquishing, from a therapist's perspective, relinquishing the need to control the outcome of the patient. Because after all, this is the patient's life, right? They eventually need to learn to take care of themselves with wisdom and compassion, which I think underneath it all really is what is required of the healing profession in the first place, is to take accountability for our own pain and also to find our own way into the light, like the plants. This is natural law, okay? Sentient beings are like that. We're all ultimately drawn into the light of wisdom and compassion. This is, I think, what Shinran calls Chinen, okay, or naturalness, right? This is the way things work. This is the universal law that anything that is broken will move towards healing. Anything that is negative will move towards positive. Anything that is painful can move towards non-painful. Dukkha naturally moves towards nirvana. And then it reminds me of the words of Rumi. The wound is where the light enters you. And that heart is a Kintsugi product of pottery, which is repairing fractures with gold or liquid gold. We are all like that. We don't get through life without getting chipped or broken or even fragmented. And even though it seems like a metaphor, the light that Rumi talks about, the Amida talks about, the Chinran talks about, the light of Amida, has to be made real and felt for each one of us, and therefore it becomes part of the conversation, which is a lot of conversation when we're talking about healing trauma, lots and lots of conversation about how this light manifests in one's life in real terms. And that can be as simple as somebody offering you a drink when you're thirsty, okay? Or somebody giving you an opening in the freeway when you need to find an exit. It's little things like that we take for granted, that we overlook. All of these all add up to how amazing life can actually be, but we have to pay attention. Like in the plane, right? I can't ever reach those things up there because I'm too short. If I don't climb the seat, I won't ever get my luggage up there, but there's always a nice bodhisattva, strong man comes like, may I do that for you? It's like, it's so amazing. So part of this gratitude practice, is to just be amazed by all these little things. That there can be awe in the context of struggle, okay? There can be wonder in the context of what seems so hopeless, like that. Because it's all there as well. We just don't know how to find it. So perhaps part of this, sobriety program we're talking about, right, is to specifically look for those little glimmers of manifestations of what compassion feels like, that we can be grateful for. The statue there, the sculpture there is by Paige Bradley. I think it's in New York or something. But that one really strikes me as how how we are as human beings, addicted or not, mentally ill or not. We are all like that. We are all fragmented. But it's okay. It's okay. Because we can all heal as well. And I think that's my last slide. Thank you so much, Mama and Dubs.